trying to save lives and keep people out of the hospital. And once we get through this pandemic, we can try to get back to our more normal dose that we're getting for a given week is being administered. So we appreciate all that the local governments are doing as well to try to help get us through this pandemic.
Hello, everyone, and welcome to a special edition of the I Heart Mount Airy show. My name is Gina Campanelli. I am the Director of Community Development for the town of Mount Airy, and we welcome Ed Singer, the Carroll County Health Officer, and he'll be with us for the next half hour or so, and we will be focusing on COVID and the COVID vaccine. On our panel is Mr. J.A. Tony Burke, who is a reporter for the Messenger, Mount Airy Messenger, our small local newspaper here. We also have Ashley Collier, our Parks and Special Events Coordinator for the town of Mount Airy. And everybody's giving a little wave as I introduce them. And Melissa Thorne, Economic Development Manager for the town of Mount Airy. And we are joined by Mr. Ed Singer again and Maggie Kuntz. And thank you again so much for joining us. My first question I will take is, you could tell us, Mr. Singer, a little bit about you and your background.
Okay, I guess I'll just start by saying I grew up here in Carroll County. I always hesitate to call myself a Carroll County native because I moved here when I was 4. So it doesn't count unless you've been here for a couple of generations. And I grew up in Eldersburg. And I went to elementary and middle school here, and I went to a private school for high school down in Baltimore. But I've lived in Carroll County pretty much most of my my life, except for times when I was deployed with the military. I've worked at the health department since 1988, and primarily worked in environmental health for most of my years here. And when the health officer position became open, when Larry Leach retired, I became the health officer here in Carroll County. I've been the health officer for a little over 5 years. I have a degree in biology from Western Maryland College, which is, of course, now McDaniel. I spent 27 years in the Army Reserves, and that took me away from the health department quite frequently after 9/11. But I've been retired from the Army Reserves for probably going on almost 10 years now. So it's been an interesting overall career. My background in the Army was I was an Army engineer and civil military affairs officer, and I spent some time in Iraq and Afghanistan and worked on some public health stuff there as well when we were working in trying to rebuild those countries while I was there. So very, very interesting times there.
Wow. Well, we certainly thank you for your service, and thanks for sharing that history so we know a little bit more about you. We also are grateful that you're here working at Carroll County and helping us be informed during this pandemic.
So we appreciate all that the local governments are doing as well to try to help get us through this pandemic.
Yeah, thank you for that. It certainly has kept us busy. Just trying to keep everybody informed is a full-time job.
Just wanted to find out how the COVID metrics look in Carroll County when you compare them to other counties in the state.
In the number of places throughout the state of Maryland and other states, and our metrics in Carroll County have comparatively been good compared to other jurisdictions in the state. Pretty much consistently throughout the pandemic, there've been a couple of times when they've gotten a little higher than the average, but most of the time we've been well below the state averages for positivity rate and for cases per 100,000. So, I attribute that to everybody's been very cooperative. We've obviously, it's never perfect. We've had to do some enforcement and things of that nature, and our folks have been busy, but it's mainly been education of people in the community who've been really cooperating with us on a lot of the things that the governor's been asking us to do, and health experts have been asking people to do to try to keep the spread of the disease to a minimum. So we have generally been below the averages in the state, and the state of Maryland's been below the national averages. So I think people here in Carroll County have been doing a great job of trying to help us limit the spread while we get through this pandemic.
Okay, all right, that's good. So you do have I know the state has a mask mandate at this point, don't they?
Yes.
Okay, so I assume that all the counties have to fall in line with that. Am I correct?
So anything that the governor puts out in his executive orders, the statewide we're required to follow. There's been a concerted effort between the Maryland State Police, the Sheriff's Office, our state's Attorney's Office, and all of our community partners to really get the word out as to what people should be doing. And I think it's important for people to understand why. And it's just, we're trying to prevent the spread of the virus and get through this pandemic and get us to the point where we're trying to save lives and keep people out of the hospital. And once we get through this pandemic, we can try to get back to our more normal lives. But yes, we have to follow the whatever's set at the state level. The counties all have the option of making more restrictive requirements, but we have to, at least as a baseline, follow what the state's put out.
Okay. All right. Well, thank you very much. Ashley's up now, I think, with a question.
Has the fact that there's been no national COVID testing and vaccine strategy hampered your efforts to control the pandemic in Carroll County?
Well, I would say that, you know, the testing strategy from a national standpoint, I don't think there was really a coordinated effort on that. The state actually tried to stand things up statewide, and I really have to thank our emergency manager in the county for helping us with our testing efforts, because we started off with Carroll Hospital actually stood up their own testing efforts, and I don't know that we were really hampered because there wasn't a national testing strategy. There was a limited resources of supplies to get testing kits in the early part, and there was actually direction as to who we should be testing and who we shouldn't be testing based on CDC guidance. So in the very beginning, there was a lack of availability of testing, and we were only trying to test people where it was really going to make a difference. But as we worked towards this, we worked with the Maryland Department of Health and with the county government, and the Ag Center gave us a great location to do this. And we started off testing about 50 people per day, and the demand grew such that we expanded the number of lanes we had and expanded up to being able to test 250 people per day. The state's been providing the support. We had CARES funding at one point in time that was paying for the testing. This is no charge to people in the county. But the state's been picking up the tab for the testing costs, and it costs about $100 a test to run a COVID test. So it gets to be very expensive. That adds up very quickly. But at the peak of the number of cases that we were seeing back in December and early January, we were testing 250 people per day, 3 days a week at our drive-through facility. As the cases have come down, and we're happy that cases are coming down and the hospitalizations are starting to come down after the holiday surge that we saw, and we hope that, you know, we're not going to see another big spike like this, but people still need to do the appropriate things with social distancing and masking to keep the spread down. The demand for our testing center has gone down. So when we started off with 50, 100 seemed like it was hard, and then 150 seemed like it was harder, and 250 I think they thought was close to impossible. But now that they're back to 150, that seems easy to them. So it's you know, the staff over there have been doing a great job. We've had a lot of volunteers and a lot of support from the county. So that's the testing side of things. Little bit more difficult right now on the vaccine side of things, because much like with the beginning of testing, when test kits and testing capacity was limited, we have a very limited number of vaccine doses that are available right now. And there is a national testing strategy, and you know, there's a group of people who are in phase 1A, which is the healthcare workers and first responders, and then 1B includes people over 75 and school teachers and continuity of government and assisted congregate living facilities. And then 1C includes people who are over 65 to 74 and some other critical infrastructure, transportation, food, and other type of services that are in that. I'm just a little concerned that I think we might have moved too quickly into 1C, and we're struggling to vaccinate the people in 1B right now. We've gotten through most of 1A. There are well over 20,000 people who are in this 1B category, and moving on to 1C, it's hard for me to get all the people in 1B vaccinated with the limited number of doses we get. We're looking at a total of around 20,000 people that are in the 1B category. And the week of December 27th, we got our first shipment of vaccine, and we got 100 doses. On January 3rd, we got 1,100 doses for that week. And the week of January 10th, we got 1,500 doses. So I was hoping that the doses were going to continue to expand and we'd be able to expand our capacity, because we have the ability, with the cooperation of the county government and all of our volunteers. There are a lot of volunteers out there that have volunteered through Volunteer Maryland to assist us with vaccine. We have more volunteers than we have vaccine right now, and I'd really love to be able to give 5,000 shots a week. But the week of the 17th of January, our allocation went down to 1,400, and on January the 24th, we were allocated another 1,400 doses for that week. But unfortunately, this week, the week of for the coming week, the week of January 31st, we only have 800 doses. So with having well over 20,000 people to vaccinate in the 1B category, and some people are already starting to vaccinate people in 1C, it's making it very difficult, and people are having a hard time understanding why, if we have 1A, 1B, and 1C open, that they can't all get vaccinated now, and why can't I make an appointment for next Friday? Well, we're limited by the amount of vaccine that we have, and that's what our biggest problem is right now, is we just don't have enough vaccine to vaccinate everybody. And we're trying to go through this as systematically as we can, and to ensure that we vaccinate the most vulnerable people in our population and those who are most at risk from their occupational category. So the vaccine's the limiting factor. We could easily vaccinate 5,000 people or more a week. And right now, this week, we've got 800 doses to work with for the coming week. And it's just, there are 4,500 people who work in our public school system that want to be vaccinated, and 11,000 people, I think, roughly in our 75 plus category that want to be vaccinated. So we just don't have enough vaccine to vaccinate them all. And even at 1,400 or 1,500 doses a week, it would take us a very long number of weeks. You can do the math to figure out what we would get there. So that's what the difficulty is right now. And I think expectations have been raised because, the governor said we're doing 1A, 1B, and 1C. And so everybody who's in those groups think they should be able to be vaccinated right now. And I know the demand on the pharmacies that have started to have some availability of vaccine, and the demand on the health department. We've gotten countless calls from people who want to be able to sign up to be vaccinated, and there's only a limited number of slots. And the private pharmacies that started this week, I talked to the gentleman at Giant. There's only one pharmacy in Carroll County that opened clinics that will be starting next week. And the pharmacist at Giant told me that they opened their vaccine clinic, and within a minute, all the slots were filled. So it's the availability of vaccine is tough on us all right now. Hopefully production will increase, or we'll get more different vaccines approved, and we'll be able to expand the number of people that we're vaccinating, but that's the limiting factor right now.
Mr. Singer, could you expand upon the county's vaccine strategy, as far as you mentioned Giant, pretending I have no idea where I could get a vaccine? Where is it even available, and how could a Mount Airy resident maybe pre-register to sign up to get one? So
our PIO, Maggie Coons, is trying to keep all the resources that are available in Carroll County up to date on our website. And if you go to the Carroll County Health Department's website, there's a COVID vaccine resource page there. You can get on an interest list. It's basically to tell us that if you're 75 and over, we know you're interested, and when we have slots, we'll email or call those people, because we know not everybody who's 75 or over has a computer or has email. So we'll take phone numbers, or we'll take email addresses, and when we have vaccine available, we'll call those people and get them registered, or send them a link and they can register. So there's the interest list that you can get put on, and that's by occupation or by age or those type of things. And you can register there on the health department's page, and you may not hear from us until we have vaccine available. It may be weeks, and it may be longer, depending on how much vaccine we get. Right now, there are only two other places that I'm aware of in Carroll County that you can get vaccinated. One is through the Giant in Westminster, And if you go to our website, there's information on how to get there. I actually will tell you though, I tried it yesterday myself, and I was working, but while I was working, I had the website up, and I was on the site for it told me I had more than an hour wait. I started at 1 o'clock, and about 7 o'clock last night, it told me that there were no slots available and try again another time. So it's not going to. That's right now. The demand is such that it's not an easy thing to navigate. But we're encouraging people to try to get vaccinated wherever they can, whether that's through the health department or whether that's through another provider. So again, I tried that site, and it wasn't easy for me yesterday to even be able to access it. LifeBridge Health is also offering vaccine to people in certain categories, and there's a link on our site to their to their piece. So if I would just encourage people, and I hate to say this, I wish we had as much vaccine as we would be able to administer to people, and that people wouldn't have to wait. But you know, there are other opportunities out there other than the health department. If you can get vaccinated somewhere else, I would encourage you to do that if you're in the appropriate priority group. The other thing that I'll add though is, you know, people need to understand that these priority groups are out there for a reason. And right now we're vaccinating, the health department's only vaccinating people who are over 75 and teachers and daycare providers and those occupations. And we've pretty much gotten through most of our law enforcement and fire and EMS folks and private healthcare providers, but you know, we'll still continue to vaccinate them as they come up here and there. But the people who are in 1C are not as high a priority for us as a health department. It's going to be a long time before we can start reaching out to people in 1C, because the people 75 and older are at much higher risk, and those occupations where you've got a high risk of exposure are also a high priority. So, you know, I encourage people, if you're eligible to get vaccinated, if it's not your turn, you know, and you really don't fit into one of those categories, don't be trying to sign up for a vaccination clinic. One of the things that's been difficult for us is we send links out to specific groups. And if we send it out to people that are 75 and over, and people who are not 75 and over sign up for the clinics, it makes it a hassle for us, because all we have to do, you're not going to get vaccinated. We're going to cancel your appointment. And we're going to send you an email that said you weren't supposed to sign up for this clinic. So we want people to get vaccinated as soon as it's their turn. But if you're not in the appropriate group that we're vaccinating, we ask that you not share our links and that you not try to sign up for a clinic you're not eligible for. We also had a second dose clinic that we had a whole bunch of teachers sign up for, and they hadn't had their first dose yet. And this was specifically for people who had already had their first dose to get their second dose. So the sharing of our links for our clinics has been a little bit of a problem for us. And we just ask people, we want to get everybody vaccinated as quickly as we can, but we have to go through this in a systematic process to take care of the people who are most at risk. So hopefully that helps answer your questions. Is there anything that I missed that you wanted to hear?
You did great. But what I got from that is just a sense of keep trying, right? If you're on the website and you're getting denied, just don't take it personally, because it's kind of out of our control, it sounds like, as a county.
Yeah, we wish we had a lot more vaccine than we do. And I do want to make a point of, and I don't know if I'm going to answer somebody else's question or not, but a point of that you know, every dose that we're getting for a given week is being administered. So it's not like there's anything that's sitting around on the shelf that we could potentially vaccinate somebody else with. It's just the limited amount of vaccine that we're getting is keeping us from vaccinating more people.
Thank you for that. And we will share those links and resources in the description of this video when we post it. So if you missed it, don't worry, we'll have it there in the description. And you did answer part of my question, the next question, as far as you shared with us the numbers that you're receiving, and you're administering all those that you receive. But how many does it take to be considered a successful vaccination program? What percentage do you need to significantly reduce the number of people infected or hospitalized?
Well, I think the goal that CDC has set is to try to get 70% of the population vaccinated. And there are I think roughly 168,000 people in Carroll County. So we're very much in the infancy of this. We've vaccinated, we're getting close to 5,000 people that we've vaccinated. Carroll Hospital has I don't know what their exact numbers are, but they've vaccinated thousands of people as well, including some of their affiliated practice people, and they're starting to vaccinate people that are in certain priority age groups. So they're vaccinating some people, but the goal is to get to approximately 70% of the population so that we can really kind of bring the spread of this in the community to a halt, and maybe we can start getting back to a more normal life that we knew before COVID.
What do you say to people who don't believe in the vaccine?
Well, and there's always going to be some people who don't believe in the vaccine. However, we've been there's a lot of good information on our website again that talks about the vaccine and have links to the things where you can read about what was done as far as the trials and all are concerned. But the vaccine's very safe, and I really, as I said, I thought there was going to be, Mr. Burke, I thought there was going to be a lot more hesitancy of people to get vaccinated, but we really haven't seen that to any large extent in our community. So, all I can do is point the people in the direction of the studies that were done. They've gone through extensive testing. You can look at me as an example. People want to say you're going to grow a third arm and whatever else. Because I'm the incident commander for COVID, and I was in with some of the first people to get vaccinated, and it didn't have any side effects at all with my first vaccine. And I think as people get out there and start talking about their experience with getting vaccinated, it's helping to make other people more comfortable, for one. And the other part of that is this vaccine has, depending on which vaccine you get, somewhere between a 90 and 95% effectiveness based on studies. And our flu vaccine, for instance, because there's different types of strains and that type of thing, which we think is very important. If we can be 45 to 50% effective with that vaccine, that's great. So 90 to 95% effectiveness is a really, really effective, good vaccine when you're talking about vaccinating somebody for a virus. So it's safe, it's effective, and the best we can do is give people the information. We're not going to force anybody to be vaccinated at this point in time. It's the first year of a new vaccine, but we try to educate people and encourage them, just like we did with, there was a lot of hesitancy to follow a lot of the rules that we had that the governor put out with some of the executive orders and things early on in the pandemic. And as we educated people on why it was important, it was a lot easier to get people to accept these things and to try to help us get through this pandemic. And I think it's the same thing with the vaccine. The best thing we can do is educate people and have them make a good decision for themselves.
All right, thank you very much.
And have you found that most people are coming back for that second dose and they're not forgetting their appointment? And
so we have a system in place for that. And actually, tomorrow is our first second dose clinic. So the hospital's been given second doses, and they say they've had a very high rate of success in getting people back. And I think we vaccinated 103 people in our very first clinic, and their second doses are due tomorrow. And I think we have all of them but 3 signed up to come and get their second dose for tomorrow. And those 3, at least 2 of those I know went and got their second dose elsewhere. Now, that's not generally something we want people doing, because the state is sending us second doses based on who gave the first dose. So generally, you should be getting your second dose wherever you got your first dose from. And we have a scheduling system that sends people email reminders to tell them to sign up for an appointment for their second dose, and sends them another reminder when it's the day before their I got my email reminder this morning that says, don't forget tomorrow morning to show up and get your second dose at the clinic, and gives the address and all that. So we're going to send people reminders. I can't handhold everybody. If somebody has a reaction or something to the first dose, maybe they might decide that they don't want to get the second dose. But for the most part, I think most people have taken the vaccine very well without any adverse reactions. I think we're going to have a high rate of people getting the second dose, and we've got ways to reach out to them and try to remind them that it's time.
Thank you for answering.
Great. I think that wraps it up. Thank you so much for providing such valuable information for our community here in Mount Airy. We hope that you'll join us again if we have some more updates to send out to everybody.
Sure.
Great, thanks so much.
Well, this is certainly helpful to us because, you know, we're hopeful. You did this for Mount Airy, and we're hopeful to make this available to the entire county. And I think it's important. You've asked some very good questions, and I think it's good information for the community to know. You know, my message to the community, just kind of wrapping things up from my perspective, is, you know, we've gotten over that holiday peak. We've gotten through the toughest spot as far as the number of cases and all. But now's the time we've got to remain vigilant and trying to limit the spread until we can get a large percentage of the people vaccinated. And when it's your turn, get vaccinated, and we're going to get through this and hopefully get back to life as normal as it could be after COVID.
Yeah. And thanks so much. I think that wraps it up for our special edition of iHeart Mount Airy. We hope this has been helpful to the community, and we'll see you next time on iHeart Mount Airy.
Thank you, Mr. Singer.
Yep, thank you all.
guys.
I appreciate it.
Thank you.